I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina. I have no financial conflicts of interest. This is part 2 of You Won't Eat GMO, but You'll Put This in Your Eyes. The Goodfellas of Stimuleyes, M2 Biologics, Neobiosis, and Truax Patient Services. Who or what is Neobiosis? In my previous discussion of biologic eye drops, and Stimuleyes in particular, I haven't mentioned Neobiosis, but they're a key player. Because M2 Biologics needs something called a Facility Establishment Identifier, or an FEI, and Neobiosis has one. So when I was reading the PDF of the label, that's where I found Neobiosis. Once again, with a lot of feeling. Amniotic fluid is not a tissue. It is a liquid. It is a secreted product. Stop it, stop it, stop it. But a lot of the smoke and mirrors that M2 Biologics and Neobiosis are playing with revolve around trying to pretend that their product is actually a human tissue. And once again, I refer you back to FDA regulation of biologic eye drops for more detail than you probably want. What's a Facility Establishment Identifier? It's a number which gets tagged to, basically, a building. Sometimes a firm, but the firm owns the building. And what you use it for, or rather what the FDA uses it for, is to track inspections of a regulated establishment or a facility. So the facility might actually be put to different uses over time. It might make vitamins, and a few years later, it might make face cream, and a few years after that, it might make hairspray. But it's the same facility. So the FDA always knows what physical structure they're talking about when they go to inspect it. In this case, for cleanliness, extreme cleanliness. Nobody's lunch bag out on the countertop. So Neobiosis turns out to be the amniotic fluid processing lab. What do they have to say about their liquid? Disclaimer: our human cell, purified amniotic fluid, and tissue products are not FDA approved or licensed for the prevention, treatment, diagnosis, mitigation, and/or cure of any disease or condition, including COVID-19. So if you add that to the disclaimer on the Stimuleyes website, what you've got is a product which no one makes any guarantees will do anything to you at all, good, bad, or indifferent. This was also on the Neobiosis webpage, and I'm not going to read it to you. I can tell you, though, it is just such BS. Neobiosis has a Food and Drug Administration registration as a human cell and tissue establishment. I looked this up by following their FEI number through the chain. Interestingly, the phone number given here goes to voicemail not set up. But I was able to dig around and eventually find a good phone number. What is Neobiosis actually allowed to do? It's allowed to do these things: package, process, store, label, and distribute amniotic membrane, cord blood, and umbilical cord tissue. Notice that amniotic fluid is not on this list. It's not on the list because it can't be on the list, because these are tissue establishment functions and amniotic fluid isn't a tissue. It's a Neobiosis side hustle, and a very lucrative one. Has this facility ever been inspected? There's a number of different ways to search for this information using the FDA data dashboard, but the answer I came up with was no. I searched by both the firm name and by the FEI, which is pretty definitive because even if the name changes, the FEI stays the same. And both times, no data found. Never been inspected for anything, ever. I had to think about that a little bit. Snail and I put our antennae together, and we're kind of wondering if Neobiosis actually filed HCTP paperwork, but never actually told the FDA it was open for business. Maybe that's what happened. Maybe the FDA is really behind on their inspections because of COVID. But as a consumer, I kind of hope that you have to have your first inspection before you can open for business. Maybe that's naive. We're asking the FDA. What does Neobiosis actually do? Neobiosis takes amniotic fluid. I don't think they collect it. I think they buy it. and they turned it into Stimuleyes. I had a conversation with one of the representatives a couple months ago. I haven't tried calling them lately. I don't think they'd take my call. But she assured me that they were a contract manufacturer. And I asked some delicately probing, seemingly stupid questions, and it was confirmed that they started with amniotic fluid, and at the end of the day, they had a product which was bottled, labeled, packaged, and ready for shipment. So, you know what this is? This is called manufacturing a drug. Yes, it is, because Stimuleyes is a drug, and they made it. And they actually admit it. Contract manufacturing. The problem is they're not actually allowed to manufacture drugs, because if you manufacture a drug, you're a drug establishment, not a tissue establishment. And they do not have a registration as a drug establishment. I tried Neobiosis, no matching records found. Try another search. Okay, I just tried Neo. 10 records came up, and none was Neobiosis. So you've paid $229 for half a cc of amniotic fluid. We've got 2 of the 3 Goodfellas, M2 Biologics and Neobiosis. Question, does it work? M2 says, no claims concerning the biological properties of its allograft tissue. Neobiosis says it's not FDA approved or licensed. Is it safe? M2 Biologics says may not preclude transmission of disease. Neobiosis is silent. Who makes it? Well, until I read that package insert, I actually thought it was M2 Biologics. But it turns out that they are just the marketing frontman, not that you'd know. Neobiosis is the contract manufacturer. Does anybody have an FEI registration for tissue? Well, M2 Biologics doesn't, Neobiosis does. Good for them. How about for drugs? M2 no, Neobiosis no. Seriously breaking the law here. Has it ever been inspected? You don't need to inspect the front man. Neobiosis, the answer appears to be not yet. So the Goodfellas are really trying to sell us on the idea that this liquid eye drop is actually a tissue. But this is what we really know. Stimuleyes is not an approved drug. Neobiosis is not a registered drug establishment. It's not being inspected as a drug manufacturing facility. And actually, it hasn't been inspected at all. M2 Biologics and Neobiosis are pretending that Neobiosis is processing and M2 is marketing for sale a human tissue product that is exempt from FDA regulation. But by now, you are much smarter than this. You know that's not true. Well, now we need the third Goodfella to fill in the blank on its prescription. Stimuleyes webpage uses words like prescribe and dispense. So optimally, M2 would layer on some credibility by having a pharmacy somewhere in this process. So we've got Scam Pharma. Scam, Neobiosis, and M2. Pharma, Truax Patient Services, LLC, providing cost-effective and patient-centric solutions. Here's how it works. Neobiosis makes it. M2 fronts it. M2 ships it to Truax Patient Services, or maybe Neobiosis just ships it directly, saving M2 a step. If you're an eye care provider, you can buy Stimuleyes directly from M2 Biologics, not Neobiosis. They're hiding on the product label. If you've purchased it, you can then dispense it directly to your patients. If you haven't purchased it and you're an eye care provider, you can pretend to prescribe it to your patients by uploading a form to Truax Patient Services. I actually called Truax a while ago. What they said was, we don't make it, we just ship it. So after your doctor fake prescribes it to Truax, Truax will call you, the patient, get payment information, and ship it to you. That's how it works. So tell it to the judge. Each one of these 3 Goodfellas has a reason why it's the other guy. Neobiosis will say, we just make it. We don't sell it to patients, and we don't make any false FDA claims. M2 is going to say, we don't make it, we just market it. The package insert is what matters. Truax will say, we just dispense it. The package insert is what matters. Regenerative medicine. Be smart, always read the package insert. Get your magnifier out. I just want to highlight once again that text in the red box. Current technologies may not preclude the transmission of disease. So frankly, Snail says he'd rather eat GMO. I hope these 2 talks have been helpful to you in understanding Stimuleyes and the 3 Goodfellas of M2 Biologics, Neobiosis, and Truax Patient Services. Thank you for listening.